We're going to go through some rib cage expansion, focusing on both lateral, frontal, or anterior and posterior expansion, thinking about expanding in all areas of the rib cage so we can successfully get that nice 360 breath that helps. Today, we're going to focus on rib cage expansion, both laterally, anteriorly up into the chest, and posteriorly behind us. When we move into that lateral expansion, thinking about getting more movement in those upper ribs, the ribs that attach to the sternum, and that we want to expand outwards. Oftentimes, we get more of that movement in these lower floating ribs. So when we go into our lateral expansion breathing, thinking about placing the Pilates ball or just kind of a squishy ball a little bit higher so we can get expansion of these upper ribs that we want to move. Ultimately, we're creating space in the rib cage so we can optimize every breath we take and manage pressure through the system. So for today, just get a rolled up towel, a Pilates ball. You want this to not be fully pumped, a little bit deflated, and a yoga block to rest your head. So we're going to first start in our lateral expansion breathing. So we're going to lay on our side, taking the Pilates ball or whatever ball you have and kind of putting it right below the armpit area. And once again, this is to help drive expansion on the opposite side, but more on those upper ribs versus those lower floating ribs. So when we lay on our side, coming to about a 90-90 position, so 90-degree bend in the hips and 90-degree bend in the knees. I'm placing this squishy ball underneath my kind of upper ribs right below the armpit area, and I'm bringing my knees up to that 90 degrees. One thing here with that position is you want to make sure that you're not open up and these kind of lower ribs are in that flared out position. So you might want to take this upper knee and just kind of push it forward just a tiny bit so you can feel and sense that you are kind of almost kind of turning towards that side, and these ribs right here on the lower ribs are not flared out. So in this position, I can even place my hand on these upper ribs, or I can take it above, whatever you find more comfortable. And I'm going to think about a nice inhale into this space underneath the armpit. Remember these higher ribs. Inhale, and then exhale. You're going to do a nice long haw exhalation, getting all the air out that you can until you feel that kind of abdominal tensioning. And then once you kind of get all that air out, we're going to take that inhalation again. On exhale, it's almost like you can feel like the ribs are kind of traveling back in space. We're not crunching down and compressing. We're allowing them to kind of curve and float backwards. So taking about 5 to 10 breaths in this position. Ideally, you're feeling that movement up here and maybe a tiny bit in the backside. This kind of curve sensation of the breath as it travels on inhalation. You want to stay here for about 5 to 10 breaths or whatever feels comfortable to you, and make sure to do the other side. Moving into a little bit of that posterior expansion on the back side of the rib cage, grabbing the same ball. You can also use a yoga block if you find that more comfortable. We're placing this on one side at a time, more on that lower ribs right through here. So essentially we're compressing that front side, preventing those lower ribs from flaring out and expanding, and allowing us to get expansion on the back side of the body. So I'm coming into that rock back position. So my booty is on my heels and I'm placing the Pilates ball kind of on those lower ribs in this case on my left side, and I'm rounding over the Pilates ball. You can take your palms up or down. I tend to prefer them to be down, but totally up to you. Keep your gaze forward towards your hands. On inhale, thinking about all that air traveling backwards, and then on the exhale, almost envision kind of folding over the ball. The great thing about this position is, in this case, I'm getting that expansion on the left side of the rib cage, but I'm also feeling a little bit of lateral expansion on the right side. So you're getting a little taste of both in this position. So you'll want to repeat that for about 5 to 10 breaths per side. So far we've done that lateral expansion, that posterior expansion. Now we're going to think about that anterior expansion. Often chest breathing gets a bad rap and is synonymous with kind of hyperventilation or kind of paradoxical breathing, but breathing into the chest or kind of the sternal area is really important because we need to have that movement for inhales and exhales. Oftentimes moms or in general we're very compressed from feeding baby or just living a very forward life, and getting some more chest expansion can help naturally like open us up and help us get in better breaths and help us kind of shape change our rib cage and where the shoulders kind of like to sit on that rib cage. So this is going to help us with kind of lifting overhead and doing all the things. So this feels really great. There's lots of positions we can experiment with, but for now, grab a rolled up towel. You're going to place this on your back right around the sports bra or the bra line and kind of play around with it as you get situated. So what this is going to do is essentially elevate the sternum up. If you feel like when you get in this position that your ribs kind of flare up, don't worry about that too much because we'll be able to control that with the breath. So in this position, kind of sensing and feeling like that sternum is elevated. So as we take an inhale, we can get some nice breath and air into this space. Inhale, and then exhale. If for whatever reason this is uncomfortable for your neck, you can also place something behind you for a little bit of support. Inhale. Exhale. You can play around with hand position. Sometimes taking the hands out, you might feel just a little bit more open and able to receive that space. On exhale, you should hopefully feel like those ribs are sort of melting and curving backwards in space. So if you are in that little more kind of flared position here, they kind of melt back and we feel that closing on the front side. Watching that you're not flaring here, so if needed, you can take a slight posterior tuck. So hopefully these give you some ideas for working on overall rib cage expansion, both laterally, posteriorly, and in the chest area. Overall, this is going to help get that expansion that we need, because if we have those straight ribs and we're kind of compressed, it's more difficult to manage pressure through the system. We want our ribs to be nice and curved, and also to be able to get in an optimal inhale and a solid exhale. Give these a try and let me know what you think.